Paracti is a rural community located in the tropical region of Cochabamba, one of the 9 departments of Bolivia. It sits along the highway that connects 2 major cities, Santa Cruz and Cochabamba, on the 84th kilometer from the direction of Cochabamba. It has a population of a little more than 12,000, most of whom, around 90%, have migrated from even further, more rural communities. The present-day health services, which only consists of a nurse, operate out of a Lent building, a very old construction with only 2 decrepit rooms. One of them functions as a room for consultations, labors, and an infirmary. The other serves as an improvised ward for patient stay. The nurse is the only health practitioner within the surrounding area for miles. In these conditions, seeing to patients and labors becomes very difficult. Being by the side of the highway, Paracti receives a variety of emergency cases tied to traffic accidents. They have to resort to only stabilizing the patient before referring them to the next level of attention. In accordance with the classification from the United Nations Development Program, the municipality of Colomi, where Paracti is located, has a medium development index in line with that of Bolivia. The Human Development Index measures on a scale of very high, high, medium, and low. Most of the Western world counts with very high and high development, and many of the countries in Latin America are slowly progressing with indices of high and very high as well. This makes Bolivia one of the most underdeveloped countries in Latin America. With the health infrastructure lacking, it makes it much more difficult to utilize governmental health programs and hinders the performance of medical professionals.
Patients will you see in a week or a day?
Dependiendo. Yo he sacado hace 2 años porque a los que viven más.
Many people have died from trauma in search of medical assistance, while on the road to further communities with more developed health systems. The municipality of Colomi and the community of Paracti do not have sufficient economical resources for the construction of an adequate health center. Mano Bolivia, a non-governmental organization and a non-profit, hopes to support Paracti with the construction of a new health center and living quarters for clinic personnel, which would fill all technical regulations and include up-to-date equipment.
The community leaders and others in the community, we visited the other clinic that you have now.
Antes de visitar este lugar donde posiblemente se va a construir, hemos visitado la anterior posta que tenía.
To improve this situation, Mano is searching for the financial counterpart to complement the resources of the community and the municipality. The total cost of the entire project of building a new health center is $72,000 and is nearly half the commercial cost of these types of infrastructure projects. The municipality of Colomi will participate by contributing 63% of the total cost, including construction materials and equipment. The community of Paracti will contribute 3% of the total cost. In addition, they will participate by sending volunteer workers to support the project. We need to obtain the remaining 35% through contributions and donations to cover the total cost of the project.
Y a las 3. Aplausos, por favor.
The new health center will have 2 doctor's offices, a dentist's office, a nurse's office, a delivery room, 2 rooms for inpatient stay, a vaccination room, a kitchen, 2 bathrooms, a waiting room, and, as well, a separate structure as housing for clinic staff, including 4 bedrooms, 2 combined kitchen and dining rooms, and 1 shared bathroom. In the development process, we hope to instill a sense of responsibility and empower the community by utilizing local volunteer work from Paracti to aid the construction workers of Mano. The construction process of a health center normally lasts 3 months, later to be equipped and inaugurated and deemed ready for use. Our objectives with this project are to make possible round-the-clock emergency medical attention, to improve the community's health with periodical visits by doctors and dentists, to bring more satisfaction to the clinic personnel, to increase preventative medicine, including the number of immunizations, to decrease health costs for patients, to decrease the local child and maternal mortality rate, to improve the access to governmental health programs. All of this will fortify the local health system in an integral way. As an added benefit, the health professionals of Paracti will receive periodic continual education courses put on by Mano Bolivia.
Y eso es suficiente con un...
This future infrastructure will enable the Bolivian government and the municipality of Colombia to provide more personnel and more medical equipment, including an ambulance, a trend that has been observed in past projects with other municipalities. We are very grateful for any support that you give for the construction of a new health clinic in Paracti, a community with such dire needs for one. It will definitively better the quality of life of the persons in this region.